Up next is the Ruma Ashwamedham, Who Am I, for the postgraduate students. We have our request masters, Dr. Gayatri MS. She's the Senior Specialist, Department of Rheumatology and Immunology, Ashram Calicut. And Dr. Chandu AS, Associate Consultant Rheumatologist, BMH Calicut.
So I'd like to request all the quiz teams to come forward. Those who haven't registered can also participate now. We need a team of two persons per team. Please come forward. We'll have the prelims at first. Prelims will be in paper. Paper or table?
Teams come, please. We want to finish and we want to start on time. Thank you.
30 seconds.
Good evening. So let's start our game show. So we have first 15 teams are there. So we will start a preliminary round in which there will be MCQs. So you have to write down the correct answers. In that main thing is 4 points will be there for each correct answer, and on negative marking will be there for the wrong answer. So out of this 15 teams, 5 teams will be selected for the finals. Okay, let's start.
Each question will be allotted a time of 30 seconds, okay? Timer in 20 questions are 30 seconds per question. So majority are one-liners because of for want of time. So first question, characteristic renal involvement in IgG4 related disease. A. Crescentic glomerulonephritis. B. Tubular interstitial nephritis. C. Renal artery thrombosis. And D. Membranous nephropathy. Moving on, which is the most common pattern of ILD in Sjogren's? A. NSIP, B. LIP, C. UIP, and D. OP, organizing pneumonia. Moving on, among the manifestations of SLE, Gilliam classification is used for A. Arthritis, B. Cutaneous features, C. Lupus nephritis, and D. Gastrointestinal involvement. Moving on, which antibody are you expecting in this patient? A. Anti-dsDNA, B. Anti-U3RNP, C. Anti-THTO, and D. Anti-MI2. Moving on, mechanism of action of belimumab. Monoclonal antibody against CD20, monoclonal antibody against CD19, monoclonal antibody against CD34, monoclonal antibody against B-lys. Next, a 12-year-old girl presents with recurrent cough, breathlessness, hemoptysis in childhood. She also has inflammatory arthritis of the small joints of hands and elevated inflammatory markers. CT chest shows features of ILD. Autoimmune workup shows a positive ANA, positive rheumatoid factor, but all infection workup comes negative. There is a family history of similar lung disease in the family. So, which is the most likely diagnosis here? A. ANCA-associated vasculitis, B. SAVI, C. COPA syndrome, and D. Goodpasture syndrome. And I just want to point out that there are certain start questions here. So if there is a tie, we'll be deciding based on the start questions. Cough, dyspnea, hemoptysis, arthritis, CT showing ILD, positive ANA, positive rheumatoid factor, family history. And the image, that is the pathology, pathogenesis. Over. Which of the following scoring system is not related to Sjogren's? Focus score, modified Rodnan score, Chisholm and Mason grading system, Van Visual staining score. Okay. A 45-year-old lady presents with 3 months history of dry cough and dyspnea. She gives history of arthritis of small joints of hands. X-ray shows features of non-specific interstitial pneumonia. And these are the images. So what is your diagnosis? Rheumatoid arthritis, lupus, systemic sclerosis, or dermatomyositis? Arthritis, ILD, and the image. Okay. So which of the following is least likely feature of IgG4 related disease? Type 2 autoimmune pancreatitis, iotitis, retroperitoneal fibrosis, salivary gland enlargement. A 10-year-old with systemic juvenile arthritis presents with high fever, hepatomegaly, and cytopenia. So the following features support diagnosis of macrophage activation syndrome except increasing ESR, hypertriglyceridemia, hyperferrinemia, hypofibrinogenemia. So a systemic JAA move developing mass, which of the following is not seen or least likely? Okay. So 11, following pH medications cannot be combined. Tadalafil with macitentan, ambrisentan with treprostinil, riociguat with sildenafil, or selexipag with epoprostenol. So all this was discussed in today's sessions. If you have been attentive. Okay. 24-year-old woman with lupus nephritis class 3. She received 6 months of MMF and tapering dose of steroids. Her proteinuria, which was 3.4 gram, reduced to 1.2. Urine is inactive. Creatinine is reduced to 0.9. Now she is pregnant. So what will be the next line of management for her? Continue MMF, switch to tacrolimus, switch to IV cyclophosphamide, switch to oral cyclophosphamide. Class 3 lupus received MMF, steroids, proteinuria, reduced to 1.2 gram. Urine is inactive. Creatinine improving. Pregnant. Okay. Which among the following antibodies is least seen in drug-induced loops? Antihistone, anti-single-stranded DNA, anti-double-stranded DNA, and nucleosome. Okay. Which of the following is not typical of sarcoidosis? Elevated ACE, elevated 25 hydroxyvitamin D, elevated 125 hydroxyvitamin D, and elevated chitotriosidase. And this is a star question. A 3-week-old male child presents with profuse watery diarrhea, failure to thrive, and diffuse eczematous dermatitis. He develops DKA at 6 weeks of age. Labs show elevated IgE, eosinophilia, and persistent thrombocytopenia. Stool studies for infection workup are negative. Endoscopy shows a villus atrophy with lamina propria showing lymphocytic infiltration. And we have an image snippet there. Which of the following is the most likely diagnosis? Autoimmune lymphoproliferative syndrome, severe combined immunodeficiency, IPEX, or viscotalric. Watery diarrhea, failure to thrive, eczema, DKA, IgE, eosinophilia, and thrombocytopenia. Okay. Hemodynamic definition consistent with pulmonary arterial hypertension. Mean pulmonary artery pressure more than 20, pulmonary vascular resistance more than 2, or arterial pressure more than 15. Okay, you can read up. Okay. A 35-year-old male presents with left eye floaters and diminution in vision. No other systemic features are present. So ophthalmologic evaluation shows features of left eye retinal vasculitis. Urinalysis is normal. And we have the X-ray image, which is the most probable diagnosis. Granulomatosis with polyangiitis, sarcoidosis, Sjogren's, or Takayasu. Okay. Which myositis subtype is the most common associated with malignancy? Anti-MDA5, anti-TIP1 gamma, anti-Jo1 is anti-synthetase, or inclusion body myositis? Maximum risk of malignancy. Okay. Melzer stride is seen in tuberculosis, Charcot's arthropathy, rheumatoid arthritis, cryoglobulinemia. Okay. Major mechanism of action of methotrexate. Major. Inhibition of dihydroorotate dehydrogenase. Inhibition of xanthine oxidase. Inhibition of ICAR transformylase. Inhibition of cyclooxygenase. Okay. Okay, we shall start the discussion of the answers while your answers are being corrected. So, characteristic linear involvement in IgG4 is tubular interstitial nephritis. Most common pattern of ILD in Sjogren's. Okay, many of you are opted for LIP. Characteristic is LIP. Most common is still NSIP. Among the manifestations of lupus, William is used for cutaneous features. Antibody we are expecting here is MI2. So this is the classical rash of dermatomyositis, MI2 dermatomyositis. What we are seeing is the Gordon sign and the heliotrope rash. Okay, this is not lupus. Why is this not lupus here? Why is this answer not DSD here? Anybody? Lupus can have a photosensitive facial rash as well, but the hand rash is not typical of lupus. Why? What is the difference? Lupus can also have a photo. This is also a photosensitive site. So why is this not? Why it's not lupus here? Knuckles. So what you have is we have rash in between the knuckles. Okay, there are space between the knuckles, the MCP and PIP specifically, and not the space between them, and not the MCP PIP. Belimumab acts is a monoclonal antibody against BLIS. Okay, so this is a tricky question. This is a 12-year-old with ILD, arthritis. In them, ANA and RF can be positive also. So the pathology here, and there is a very strong family history of ILD. Pathology here shown is, we have removed this. So this is the Golgi mitochondria apparatus showing the action of COPA. So this is actually COPA syndrome. Scoring system not related to Sjogren's is modified Rodden score, that is for skin score for scleroderma. And this is anti-synthetase syndrome. So ILD, arthritis, image of ILD, and the hand is showing mechanic's hand. Okay, so anti-synthetase dermatomyositis. 9. So least likely feature of IgG4. Why is type 2 autoimmune pancreatitis? It is type 1. 10. All are features of mass except increasing ESR. So ESR tends to drop. ESR, there is a fall in ESR as we approach mass here. So that is one important thing in mass. So patient with systemic JA, you monitor them a single value of ESR is not going to tell. So if there is a ESR of 90, it is becoming 70, it is still going a trend of mass, that is still dangerous. Which following pH medians cannot be combined, riazigowad and sildenafil, which leads to dangerous hypotension. So this was all mentioned in Dr. Shenasar's PPT. 24-year-old, this is simple. The case is big, but only thing ultimately a pregnant woman in remission. So what to do? Switch her to tacrolimus. MMF is not compatible with pregnancy. And once somebody in remission, you are not going to escalate immunosuppression. Suppose she was not in remission, suppose there was increasing redundant proteinuria or active sediment, so you will advise against pregnancy and augment immunosuppression. Somebody who is going in for remission, 6 months in remission, you can switch them to azathioprine or tacrolimus and advise for pregnancy. So there is no role for MMF, cyclophosphamide or MMF or cyclophosphamide. One thing is that she is not in remission, and the other thing is that she is in remission. The other thing is that she is planning pregnancy. Least seen in drug-induced lupus, dsDNA specific. dsDNA and Smith are more specific for lupus per se. So least likely seen here is dsDNA. Not typical of sarcoid. So all other things are seen. This chitotriosidase is a marker of macrophage activation. So that can also be seen in sarcoidosis. 25-hydroxy vitamin D is going to be rather low rather than elevated. 3-week cold with profuse watery diarrhea, failure to thrive, rash, DKA, elevated IgE, eosinophilia, thrombocytopenia. Stool workup is all negative. So that rules out severe combined immunodeficiency. And we have this image. So can anyone tell me what this is? What these 3 people are? Nobel Prize for? Yes. So that is IPEX. Okay. So pH, this is the definition. Mean pulmonary artery more than 20, resistance more than 2, and pulmonary artery wedge pressure less than 15. 17, this is straightforward. Sarcoidosis, left eye floaters, decreased vision. We are pointing it for retinal vasculitis and image showing hilar adenopathy. This you can't get wrong. 18, myositis with the most highest risk of malignancy is stiff-1 gamma. Melzostride is seen in cryo. So what is melzostride? Anybody? Arthritis and? So it is specifically seen in essential mixed cryoglobulinemia, and that is what the triad. Arthritis, purpura, arthralgia and weakness. Major mechanism action of methotrexate is this. So we know it inhibits dihydrofolate reductase. This is not dihydroorotate dehydrogenase. It inhibits dihydrofolate reductase, but the major mechanism is inhibition of ICAR transformylase.
അല്ല പലരും പലരിട്ടും പലരും ചിലരിട്ടില്ല. അത്
ഇല്ല ഇവരെ എനിക്ക് ആദ്യം ഇതൊപ്പണയുണ്ടോ?
അല്ല ഇവിടെ വരില്ല.
ഇല്ല ഞാൻ ചോദിക്കട്ടെ, ഇവര് രണ്ടായിട്ട് എത്തണ്ടേ?
അല്ല അത് കണ്ടുപിടിക്കണ്ടേ ആദ്യം. അത് കണ്ടുപിടിക്കണ്ടേ.
കണ്ടുപിടിക്കുമല്ലോ.
അത് ഇവിടെ തന്നെ ഇരുന്നാണ്
ഓഡിയൻസ് ക്വസ്റ്റ്യൻ കേട്ടോ? ഓഡിയൻസ് ക്വസ്റ്റ്യൻ
വേണ്ടെന്ന്. കറക്റ്റായിട്ട് വരുമോ?
ഇല്ല, സ്റ്റാർട്ട് ക്വസ്റ്റ്യൻ ഏതൊക്കെയാണെന്ന് പറയുമോ?
അല്ല എനിക്ക് തോന്നുന്നില്ല ആർക്കും സിമിലർ ആയിട്ട് വരുമെന്ന്.
സ്റ്റാർട്ട് ക്വസ്റ്റ്യൻ
ടീംസ് ആകുമ്പം
പ്രോപ്പറായിട്ട് പേരെഴുതി മേടിക്കണം, ചെക്ക് എഴുതി കൊടുക്കണം. ഇപ്പോൾ ഫസ്റ്റ് ടേബിളിലേക്ക് വരാൻ വേണ്ടി
ഇല്ല, അത്
ടേബിൾ വെച്ചാൽ പോലെ
ഇവിടെ ഇവിടെ
ഓരോരുത്തർ വിളിച്ചാൽ മതി. അവിടെ
വിളിച്ചിട്ട്
രണ്ട്
ചേർത്ത്
ചേർ വെച്ചിട്ട് ഓരോരുത്തർ വന്നിരുന്ന് പറഞ്ഞിട്ട് പോകും.
ആ മതി 2 ചേർ ഇട്ടാൽ.
ചേർ മാത്രം
ഒരു ക്വസ്റ്റ്യൻ ഒരു കാൻഡിഡേറ്റിൻ്റെ ക്വസ്റ്റ്യൻ ഉള്ളൂ.
So we have 5 teams selected for the finals. First one is Dr. Chako and Dr. Sachin from TMC. Sit there only, I'll call you. Dr. Chaitra Shaji, Dr. Tanvir from TMC Kozhikode. Dr. Adira Sabha, Dr. Tirtha from ICRA. Dr. Nishima, Dr. Suhana. They didn't write which. Dr. Shifa and Dr. Hasna from ICRA. So it is not like just another finals. So these 5 teams will get equal cash prize if they got the correct answers. So that means there is no first prize in this finals. Each team will get a question, and there will be 6 clues for each question, and if they are correct, if they are able to answer the questions with the least number of clues, they will get more prize money.
ഏതൊക്കെ ടീമായിരിക്കും?
ഫസ്റ്റ് ടീം ഫ്രം TMC. എന്താ സർ? ഞാൻ ഇല്ല, ഡീറ്റെയിൽ ആയിട്ട് പറയാം. ഓക്കെ, സോ ഫസ്റ്റ് ടീം ഫ്രം TMC, Dr. Chako and Dr. Sachin, please take a lot. So we'll be giving you questions based on the lot number. Hey. Dr. Chaitra and Dr. Tanvir. Dr. Adira and Dr. Tirtha. Dr. Ishma Suhana. Dr. Shifa and Dr. Hasna. So who got lot number 1? Lot number 1. 2. 2. So lot number 1 is team from TMC. Lot number 2 is Acer Mims. 3. 3 from ICRA. 4. TMC. 5. ICRA. Okay. So we just go over the rules.
So rules.
Timer illa.
So rules are like an introduction slide will be given, which will have a symbolic representation of the diagnosis, and we will be given 6 clues. So the team members can select a random number, and that clue will be displayed on the screen. So teams will use the lesser number of clues to guess the answer will be given more money. So like this, the team answering within 1 to 2 clues will get 20,000 rupees. Within 3 to 4 clues will get 10,000. Within 5 to 6 clues will become 5,000.
So the thing is that we'll give you a riddle. You need to answer the riddle upfront. You can wait for the clues because you're not going to lose anything by taking 2 clues. So first 2 clues, it's not going to matter. So take up the clues. Up to second clue, the cash price is not going to reduce. So after that, you opt for the third clue and you get it right, it is 10,000. Opt for the fifth clue, you get it right, you get 5,000. And the main thing is that we are going to answer the riddle. So look up the question properly. You're not answering the clue. The clue is going to tell something about the riddle. Like if the clue tells you a photo, gives you a photosensitive rash, it tells that it could be lupus. The diagnosis could be lupus nephritis. Okay, so you're not going to answer to the riddle, to the clue. So if at all you answer, we may not be able to give you the award you the prize as well. Because so look at the riddle. The riddle is what we want you to solve. Okay, understood? Illa doubt ending this is show. We get out. So we want one answer and one answer only, and a complete answer. So you can take up as many clues as you want. Half answer. If it is a half answer, if you got the clue right, if you suppose you got the clue right and it is a half answer, like you got lupus but it's not lupus nephritis, we'll give you one more attempt. Okay. Any questions? So you'll have to solve the riddle.
So
You
all
can
clear?
Wait for 2 clues to solve that riddle. So why are we emphasizing is that a single thing can have multiple differences in rheumatology. So a single, it may not be always straightforward, and the prize money is 20,000. So we are not going to give it as simple as lupus or lupus nephritis. So that's why we want you to think properly before giving an answer.
One
Question only. That is the final. That's it. One question, 6 clues. You answer, you get 20,000. You can leave. We don't have time here today. That's why.
So that's what each team can get maximum prize money. There is no first prize like this. Okay, we'll go. All clear?
First team varam.
So
Team 1 can come forward. Sit. There is no time limit here, so you can. So this is your riddle. I can know.
yeah. So I linger near the eyes, making the gentle tear makers quietly rise. I settle deep in the belly, wrapping firm stubborn bands. around the effluent pipes, and wherever I want, the cartwheels flourish and scars were weaved into a heavy twisted mat. This is the riddle. You have to solve the riddle.
So you can take up questions.
Clue one.
Clues. Clue 1.
Are you going to answer in this clue?
No, back.
Next clue.
Clue 4. Back.
You are not going to answer in this clue.
Going to answer.
Huh? Yeah.
IgG for derivatives.
Yeah, it's correct answer.
So, do you want to stress on why you chose IgG for? Bispecific antibody before that?
Actually, thought the clues also we knew. It retroperitoneal fibrosis enlargement.
Yeah.
And?
So can you tell the whole riddle?
So, the lacrimal gland involvement.
Yes.
Then set it up in a retroperitoneal fibrosis.
Yeah.
Cartwheel storiform fibrosis. Scars weaved a heavy twisted.
Yes.
A big round of applause
Yes.
to team 1.
Correct.
So
Correct
they get
answer.
gold 20,000.
So I'll show the rest of the clues. So this is the MRI picture showing lacrimal gland involvement, and then you have the pituitary involvement in producing pituitary dysfunction in hypophysitis. And then we have the clue number 5, which is the thoracic mediastinal involvement of IgG4. And the 6th clue is the histopathology showing storiform fibrosis as well as obliterative phlebitis. So team 1 get 20,000 prize money. Team 2
come forward.
So this is an escape room. The room 1, outer canvas door, the lock glows red with racked maps and painful fissures. Room 2 is air leak alarm. The siren sounds. Air is escaping into forbidden corridors. Room 3 is gas exchange chamber. Both the sponges stiffen like drying parchment. Room 4 is internal defense vault. A cord shows a distant anti-sensor for innate protection is gone wrong.
You can choose your clues. Clue 1.
So clue 1 is a 47-year-old woman with no comorbidities, present with 10 days of inflammatory joint symptoms, followed by dry cough and exertional dyspnea. Physical examination reveals bibasilar crackles and maculopapular rash over hands and trunk. SPO is 88% only on room air. There is no Raynaud's phenomenon.
Back. Clue 3. Clue 3. 3. Very hard. Back.
Okay.
Back to the question. Initial.
So are you going to answer or you are going to next clue?
Next clue.
Clue number? Clue number?
Now you can choose 2 more clues. You're not going to lose
4.
anything now. 4. 4. Back.
Next clue.
Clue 2. We'll answer.
Yeah.
Yeah, please. Dermatomyositis.
You have to give full answer.
So that is a partial answer. Because the rash is lynching for one type of dermatomyositis. So answer that or you can take up an next clue. So for dermatomyositis, we are not going to give. Dermatomyositis has so many subtypes. Okay. So the rash, the clinical picture we are trying to tell is pointing to one subtype, one specific subtype. So if you get it right, we'll give it to you. If you get it wrong, since dermatomyositis is a partial answer, we'll let you proceed. But if you want to opt for an answer and you get it wrong, then you lose.
The anti-synthetase post.
That is the wrong answer, so unfortunately we can't let you proceed. So we'll just open up the remaining clues also.
So
5. What is this? Any idea?
what is this?
Carcinosis cutis.
Anybody else? Any other teams can randomly just answer.
Okay.
That was inverse Gorton. That is a Gorton's ulcer. Ulcerative Gorton. Okay.
So what is the finding in this? Can you tell?
This you didn't open. We're just opening it simply. Can you just pick out the finding here?
Okay. Okay. This is pneumomediastinum with ILD. So this is MDF dermatomyositis with ILD. So we'll go to next question. Next.
The rash was a flagellate rash.
So I'll just tell the clues. So lock gloss red with rag marks and painful fissures is the skin rashes of and ulcer. Basically the ulcer of MDFI dermatomyositis. Siren sounds, air is escaping the forbidden cords is pneumomediastinum. Both the sponges stiffen like drying parchment is the ILD, and the fourth, the code shows distinct anti-sensor. That anti-sensor is MDFI. Okay.
Thank you, team 2. We'll move on to team 3.
So, for you, the question is a weather report. This is a body weather report. So, each word is important. Just go through the each words. Body weather report, calamity in the last 1 week. And so, weather report says north zone, lightning strike and lingering fog. East and west, rivers to the dams are blocked. The central zone, storm knot formation in the central chamber. South zone, cold front advancing, risk of tissue freeze.
Clue 1. Clue 2. Takayasu arthritis.
Sorry, that is a wrong answer.
Okay,
Who are the remaining clues?
we'll go, huh?
No, they want CAPS. CAPS is the right answer. Catastrophic antiphospholipid syndrome. So clue 3 was
Clue is gangrene, and clue 4 is thrombus in the heart, and clue 5 is a stroke, and this is histiocytes, and clue 6 is the investigations.
investigation showing
I'll tell the
picture of
riddle.
TMA.
It's a body weather report. So the calamity in the first week. So CAPS occurs in the first week. More than two organs involved in the first week. That is the important thing in CAPS. So a north zone, lightning strike and lingering fog means it is the acute onset confusion or delirium occurs in CAPS. And east and west, reverse the dams are blocked, so the kidneys are getting affected. So basically the renal artery thrombosis. Central storm knot formation in the central chamber is the cardiac thrombus, and south zone cold front advancing, risk of tissue freeze is the gangrene.
Calamity we chose to be a synonym for catastrophic. That way we highlighted in
The
red.
calamity, yeah.
Tokyo.
Allah, you got.
What is this? What is this? Tokyo is this is a map of Japan, and the red dot is the place called Sapporo. Sapporo, where from it Sapporo's criteria came for APS.
Thank you, team 3.
So this is a cartoon drew by a physician. You just see the cartoon and then we'll go for the clues.
Clue 3. Clue 1. Back. Clue 5. Back. Clue 2.
Clue 2.
Psoriatic arthritis.
Wrong answer.
It's wrong answer.
Relapsing polychondritis.
Sorry?
Relapsing polychondritis.
Oh no, that is again a wrong answer. Leprosy, that is right answer. But leprosy with, we need a full answer again. Leprosy with
Erythema
erythema
nodosum
nodosum
leprosum.
leprosum. Yes.
We'll see other clues. Five. Five and two. Okay. This is destructive arthropathy in Charcot joint. So this is erythema nodosum leprosum lesions, and this is foot drop. So this cartoon is showing nodular lesions, X-ray showing arthritis, and the cigar shape. Cigar indicates cigar bundles represents the histopathological feature of lepra bacilli. Okay. So that is the caricature.
Cash was the first clue you opened it. And that showed only two differentials there.
So this is
This you could have guessed we had two differentials for this. TB or leprosy.
and this is Hansen. Okay.
Yes, sir.
So here is a poem. So coal wakes up, dark footprints due to fragile tubes. Red turns dark when chilled. A quiet giant agent flows through a green river. The dams shut down. So these are this is the poem. The clues are hidden in the poem, and we can select the clue now.
Clue 1.
Clue 1. You can choose the next clue also.
Clue 3. Back.
So,
Lavriya,
so you
you
are
want to
going.
answer or you want to choose the next? So clue 5.
So
Clue 6.
these are the investigation of the patient. Modi.
Back. Move on or you want to answer? Which one? Clue 2. Last clue ఏదన్నా?
3.
3 Wrong answer or no answer? Wrong answer or right answer?
Cryoglobulinemia.
Yes.
Yes.
Why wait so much? എവിടെ കിട്ടി?
Okay, it's cryoglobulinemia vasculitis. So cold wakes it up is a Raynaud's phenomenon, and dark footprints due to fragile tubes is a purpura, and red turns dark when chill is a cryoglobulinemia, and the quiet agent flowing through a green river is a it's infection in bile or liver, which is HCV, and dam shutdown is renal failure.
Just go over the clues. Clue 1, did you know what was it? This is the formation of a cryogrit. So this is how we test for cryoglobulins.
This is a treatment for cryoglobulinemia vasculitis with treatment of HCV and rituximab with the plex. And this is a histopathology showing pseudothrombi, and this is gangrene, and we have classical purpura, and this is an investigation which there is anemia is there with urine is showing RBCs and protein with creatinine is raised, so it's a renal failure, and we have
Nephritis.
Yeah, this is suggestive of acute glomerulonephritis. Anemia is there and low C4 and rheumatoid factor positivity with ANA negative.
Thank you, team 4. So you guys get 5,000. Team 5, sorry.
So we finished all the 5 candidates. Can we have an audience question? No, prize money will be there. If you want, we will go for an audience question also. So look at the cartoon and tell the diagnosis. Yeah, it's CBPD. So we'll see the clues. This is a 70-year-old man with recurrent episodic arthritis.
But that is not the full picture.
CPPD, what is this? This is the CPPD crystal deposit in the TFCC, and this is Ragajasi spine, and this is the parathyroid adenoma causing hypercalcemia, which is the cause for CPPD crystallization in this patient, and this is showing hypercalcemia and hypophosphatemia, and this is the rhomboid crystals, and this is the bound tumor histopathology, and this is the mechanism of CPPD crystalline formation in patients.
Primary hyperparathyroidism with CPPD.
So this is a life of Irene, a story of missing second father. Irene lived with mysteries no one could name. At times his world splits into two, and faint maps appear across his surface. Deep stubborn wounds formed where their nerve stood. Ordinary enemies troubled him more than others. Battalion of defenders were always sparse, because a quiet worker meant to keep everything in balance had been missing since birth. So, clue? This is ulcer. What is the leg showing? Okay. So libido reticularis with ulcers are there. So this is a history. So acute onset headache and nausea vomiting in a 21-year-old male. Neurological examination showing oculomotor deficit in left eye with diplopia. There is skin changes are there. BP is high. Brain showed both acute and chronic lesions. And strokes. MR angiography is normal, and so conventional cerebral angiography was normal. So this is a stroke. Yes.
Yes, this is DADA 2.
So DADA 2 with cytopenias and hypogammaglobulinemia. So this is a story of missing second father, DADA 2. Okay. So we'll wind up the session. Thank you everyone.
Thank you all.
So we will move on to the prize distribution. And I request Vinod Ravindran sir and the team from GMC Trivandrum, Dr. Chako Jacob and Dr. B. Sachin, to receive the prize money of 20,000. And every participant will get that book. It's a manual of rheumatology by Ramnath Mishra. Yeah, all 5 teams which are selected, who are selected. It's a manual of rheumatology by R.N. Mishra sir. It's a nice rheumatology book to have. Okay, so I call upon Dr. Chako Jacob and Dr. B. Sachin. Please come to the stage. Now I request Jayachandran sir onto the stage, and I invite Dr. Hassan Muhammad Ali and Dr. Shifa K from ICRA International Hospital, Calicut. They represent pediatric department at ICRA. Now I request Dr. Anup PP to the stage, and I call upon Dr. Tanveer and Dr. Chaitra, MD residents from Government Medical College, Calicut, onto the stage. Okay. Now I request Dr. Sukesh D, Organizing Secretary, and I call Dr. Adira Saba and Dr. Deertha from CRA onto the stage. Dr. Aisha and Dr. Suhana onto the stage.
I request Dr. Adarsh, our scientific committee chairperson, to give them the awards. So we'll have the national anthem and finish the function.
Okay, all stand up for the national anthem, and we'll conclude the session with the national anthem.
जन गण मंगल